Hello, everyone, and welcome to AFTD's Mission in a Changing World, the final entry in a special series of AFTD webinars brought to you in place of this year's Education Conference, which was prevented by the circumstances surrounding COVID-19. I'm Susan Dickinson, CEO of AFTD, and I'm joined by David Pfeifer, AFTD's Board Chair. On behalf of everyone here, thank you for joining us today. Before we start, we want you to know that this special webinar series is brought to you by the generous support of our 2020 Education Conference sponsors. We'd especially like to acknowledge our platinum sponsors, Elector, Biogen, Ionis, and Buffalo Trace Distillery, Gentlemen of the Pappy Van Winkle Classic. Thanks also to our gold, silver, and nonprofit sponsors for your essential support. After today's presentation, there'll be an opportunity for questions. You may submit any questions you have by typing them into the questions section, which is located toward the bottom of your control panel on your screen. Please send your questions as you think of them, and we'll answer as many as possible at the end of the presentation. Our audience will be muted for the duration of the presentation. This helps to keep the background noise to a minimum so that everyone can hear the presenter clearly. If you have any technical issues, please write a message in the questions box, and AFTD's Lauren Gauthier and Dina Chisholm will try to address them with you. We're recording this presentation and we'll post it on AFTD's website and YouTube channel. Please share it with others you think may be interested. And at this point, I'd like to introduce David Pfeifer, who became AFTD's newest board chair last month. We're grateful to have David here to share his story with you today.
Thank you, Susan. I very much appreciate that introduction, and I am very, very happy to be here today. As Susan mentioned, my name is David Pfeifer. I'm our new board chair of AFTD, a position which I began in April of this year. I'd like to thank our outgoing chair, Gail Anderson, who served in that role for 4 years and was truly an extraordinary leader of our board. And oversaw a really incredible period of growth for AFTD. And so to Gail, I say thank you. A little bit about myself. I'm an architect. I live in Denver, Colorado, from where I'm speaking to you all today from my home office, as I am home working remotely like all of us these days. I'm a father of 3 kids. 2 are in college, 1 in high school. All are home right now, and we're all relearning how to live together in ways in which we did years ago. But it's been absolutely wonderful getting to spend so much time with my kids here at home. I wanted to share with you all just a bit about my FTD story. On the screen, you see a photograph of my wife, Kathy, on the left, and my sister-in-law, Jeanette Ekstrand, on the right. Both Kathy and Jeanette passed from complications related to both FTD and ALS. Our family is one of those families to which both of these terrible illnesses can occur. Kathy was diagnosed in the fall of 2014 after years of experiencing unusual symptoms, which I'm sure so many of you have experienced. Related to communication and behavior. And after a very long journey, we finally found a wonderful neuropsychologist at National Jewish Hospital in Denver, Colorado, who helped us and was able to give Kathy the proper diagnosis. She passed away in December of 2016. And my sister-in-law, Jeanette, passed away in April of last year, in April of 2019. Both my wife Kathy and my sister-in-law Jeanette were mothers, and so we have 3 children in each of our families who have gone through this experience. And so I certainly understand the difficulty and the unbelievable challenges that so many of you are facing. I know that when my wife was diagnosed, I was fortunate to very quickly discover AFTD. And specifically, a former board member, Debbie Fenolio, who's also a Denver resident, and I became very good friends, and she became a profound resource in my life in terms of managing this illness and making me aware of all sorts of resources that are available to families that are going through this incredibly challenging journey. And the mission and vision of AFTD has always resonated very, very powerfully with me. We have an extraordinary staff of unbelievably committed professionals who have chosen this particular fight of all the many challenges that are out there. They've chosen this particular one to lean into and to give their tremendous talents and energies to. And for that, I'm terribly grateful. I do understand the journey that so many of you are on, and it is an unbelievably difficult one. And for that, among many reasons, I have chosen to try to serve on the board and serve AFTD as best I can. What my family has gone through and the challenges that may yet lie before us are profound, and those are the reasons why I have chosen to invest my time and energy and resources and ability to raise funds for all the good work that we're doing at AFTD. I'm so very grateful for the opportunity to be here today and to talk to you all, and at the end of our presentation to perhaps answer some questions. And so at this point, I think I will turn it back over to Susan. Thank you.
Thank you, David. Thank you so much for your generosity in sharing your story, and certainly for your leadership. I know I look forward to partnering with you in the years ahead. I want to start my part of this presentation by asking each of you to take a moment to picture this world after the current pandemic has been addressed. How would that look and sound for you? Spend a moment there and just picture how it'll feel to have the challenges of COVID-19 behind us. Now, with that future in focus, I hope you'll take an additional bold step. Picture a world without dementia or neurodegenerative disease, a world where every aspect of frontotemporal degeneration has been accounted for. Not only is diagnosis prompt and readily available, but treatments can halt the progression of the disease. Not only can FTD be cured, it can even be prevented. Spend a moment with us there too. Focus on the details. How would that feel, and how would it be to live in that world? As certain as I am that we will move beyond the challenges of COVID-19 in time, I'm confident that as a community, we can move past the dramatic challenges that FTD brings each day to the families AFTD serves. And now I want to share with you how AFTD is working to bring a future free of FTD. AFTD envisions a world with compassionate care, effective support, and a future free of FTD. Our mission can be summarized as simply as help and hope. We work to improve quality of life for people and families affected, and drive research ultimately targeting a cure. There are 5 related pillars to AFTD's mission. Through awareness, education, and advocacy, we teach more families, professionals, and policymakers about FTD. Through our research efforts, we seek to better understand, diagnose, treat, cure, and one day prevent this disease. And AFTD's support programs offer guidance, information, resources, assistance, and connection for those diagnosed and for families facing this journey today. Next slide. And now I want to share some reasons for hope in the impact AFTD has had over the past year in collaboration with thousands of donors, hundreds of active volunteers, and leading researchers here and around the world. Slide. We're here to inform and support the people who are living with FTD, and also to spread the word in broader society that there are many different forms of dementia, and that FTD is one which is most common under age 60. This past year, I'm pleased to report that nearly 440,000 people visited our website. More than 20,000 received our newsletters and followed us on social media. We responded to more than 2,300 helpline cases with personalized and detailed information. And we recruited and engaged 104 volunteers who led support groups in 35 states and 7 groups via the phone or internet. Next slide, please. To highlight 3 of the most important highlights from the past year. Hopefully, all of you saw the piece on FTD that aired on 60 Minutes. AFTD worked with producers from 60 Minutes, along with Amy Johnson, the very Reverend Tracy Lind, and Dr. Bruce Miller, to bring FTD awareness to 7.5 million viewers in one evening in May of 2019. CBS re-aired this episode an additional 2 times as the year went forward, bringing additional awareness to millions more. We formed an exciting new research partnership with Target ALS. Scientists discovered several years ago that these 2 rare diseases, FTD and ALS, can share a common pathology and a major gene mutation. I'm proud to announce that last summer, thanks to the generosity of the Samuel I. Newhouse Foundation, we formed a partnership with a leading nonprofit in the world of ALS research, Target ALS. Together, AFTD and Target ALS announced just this week that we are providing $5 million in funding for 6 collaborative projects between academic researchers and biopharmaceutical companies. These collaborations will pursue promising potential ways to detect, as well as therapeutic strategies to address ALS and FTD. And finally, I'm most proud to acknowledge that those of you who volunteer to help us deliver our mission to the people who need it most. Since July, more than 330 volunteers have engaged with AFTD, hosting meet and greets when you are able, bringing awareness through table settings at events, leading support groups, hosting grassroots events, serving as AFTD ambassadors in your communities, and educating healthcare professionals. Next slide, please. A significant portion of our expenses each year are invested in FTD research. AFTD itself funds a number of grant programs, including postdoctoral fellowships for scientists at the beginning of their careers, pilot grants for young but established scientists, and a major initiative to develop the biomarkers we so desperately need in order to accurately diagnose and pursue clinical trial testing of potential new drugs. But increasingly, we're finding our sweet spot in the research world as conveners, when we bring together a variety of players from government, basic science institutions, biopharma companies, and nonprofit peers to work together, focusing our joint resources specifically on FTD. Some of these efforts result in formal partnerships, like the one we have with Target ALS, others we have with the Alzheimer's Drug Discovery Foundation, and still others, including Bill Gates and Jeff Bezos, who are among our partners in the Diagnostics Accelerator. Next slide, please. In recent years, we've also had significant success advocating for increased attention at the national level. In 2019, we were extremely pleased to play a key role in securing a grant from NIH that will fund the All FTD network of 19 centers, which will work in tandem to better characterize the natural history of FTD and also play a key role in clinical trials. This grant, totaling $63 million, will fund the All FTD program for the next 5 years. We secured a place for FTD to be included among the diseases covered by the Department of Defense medical research grants. We sponsored and participated in a national summit at the National Institutes of Health, which set national priorities for research into non-Alzheimer's dementias for the next 3 years. And we were proud to be a sponsor and participant in the Dementia Care and Services Summit. Although this summit had to be canceled due to the COVID-19 crisis, we will continue our advocacy efforts in this area with the goal of ensuring that the needs of younger people with forms of dementia that are not primarily memory-based are included in national initiatives. Next slide. All of our work and the choices we're making today are guided by AFTD's 2019 to 2022 strategic plan, which specifically seeks to advance earlier diagnosis and the first treatments for this disease, advance quality care and support, build on our status as the leading organization focused specifically and solely on FTD, and ensure that even in the context of today's economic uncertainty, AFTD is going to be here for the long term, strong and focused on succeeding in our mission goals. All 4 of these goals were crafted with our long-term vision in mind, to create a world with compassionate care, effective support, and a future free of FTD. Next slide, please. And finally, for the last section of my presentation, I'd like to share with you some of our most recent activities. There was a lot we had planned for 2020, and then of course, there have been the things few of us were able to anticipate, like the COVID-19 pandemic. Since March 13th, AFTD staff has been working from our homes diligently every day to answer your helpline calls and to bring you new resources and opportunities to engage in our mission. We're aware that the current circumstances present additional challenges for people themselves dealing with the diagnosis of FTD, for their family members, and professionals who care about them and partner in their care, and for the researchers who have had to suspend much of their work to accomplish social distancing. I'm very proud of the work my team has done of our community. Next slide, please. On our homepage, you can find a special section titled COVID-19 and FTD, where we offer new resources each week targeting distinct challenges brought on by different forms of FTD and different circumstances. Many of these new resources are created in partnership with FTD experts who have made working with AFTD a priority right now, and we're grateful for their time and their partnership. If you don't see a resource that you need here, please write into our helpline or ask questions in this webinar. We will take your questions into account as we create new and additional resources in the days and weeks ahead. Next slide, please. Just like the experts, those of you on this webinar who volunteer for AFTD are valuable resources in your communities every day when face-to-face volunteer activities aren't yet feasible. AFTD's volunteer support group leaders are working hard to offer remote group options via phone and the web during the pandemic. An exciting new opportunity that more than 400 of us have signed up for. We invite you to download the free Charity Miles app and join the AFTD team on that app. Your everyday exercise, whether you walk, run, or bike, wherever you are in the country, will be logged, and thanks to the generosity of Beth Walter and the Mike Walter Catalyst Fund, $1 will be donated to AFTD for every mile you move this month. And finally, AFTD volunteer ambassadors and board members are telling their stories. I specifically invite you to look up this month's issue of Wired magazine, which features our newest board member, Kristen Holloway, sharing her and her family's story as her husband Lee battles with his own diagnosis of FTD. Next slide, please. We know that whatever this time is bringing for you and your family, you may be feeling an increased sense of vulnerability and isolation. Know that we are here for you and that each of us is facing challenges during this time. You are not alone. There are a few easy ways to stay connected with AFTD and with your peers during this time, including our helpline, newsletters, and social media. You can find all of these and more on the homepage of our website. I'd especially like to call attention to a new booklet on grief, which we published in March of this year, which shares stories and perspectives on the grief that can arise at every stage of this journey. I've heard from many members of our community who are finding it especially helpful as they face their current challenges. Next slide, please. The world that David and I, and all of us here at AFTD envision, is one that is ultimately free of dementia. To build this world, it'll take resilience and determination, things we hear every day in the voices of people affected by FTD. It'll take work by researchers, clinicians, and health professionals of every stripe, and efforts by thousands of volunteers and donors, including so many of you on this webinar today. But I know that together, we can realize the future we seek for our children and grandchildren and those who follow after. We're now planning our work for the year ahead, and we want to hear from you, whether in the questions and feedback you share on this webinar, or by contacting our helpline and telling us about your urgent unmet needs and how AFTD can help. Next slide, please. And now I'm going to invite David back to join me, and also some members of our senior team here at AFTD. And we look forward to answering some of your questions. We have Ben Freeman, who's our Director of Development and Communications. We have Aaron Denny, who is Senior Director of Programs. And we have Nadine Tatton, who is our Director of Scientific Research. Welcome, everyone. And I need to open the question box, so give me one moment here, please. Somebody wants to know how the pandemic will influence or change how the organization interacts with people in their own communities over the coming year. And Sharon, I think I might ask you to take a stab at this one.
Well, thanks. Yeah, it's nice to be with you. And thank you, David and Susan, for doing the presentation with us today. So, we've been watching along with the community as this sort of difficult situation has evolved. And a couple of things remain the same. So, Susan, as you were saying, our priority continues to be on the health and well-being of the folks in our community that we serve and that we interact with all the time. So what we know is that impacting that sense of isolation remains our top priority. That's not going to change. And so as we look at the ways in which we're extending support to the community, we are adapting. We're trying to figure out, as you had mentioned, the support groups are going to be changing over to use virtual platforms. Many of them have already. I think 51 or so groups are already using conference call lines that AFTD is making available so that they can continue to meet with their groups. And quite frankly, this was one of the first pieces of impact after we canceled the conference, the in-person conference. And it's one of the things I think we can be really proud of is that those support group volunteers first and foremost had concerns about the other members in their group almost over and above their own individual situations as they were unfolding and changing. So that's a commitment that we will continue to keep. We're going to look at additional ways and additional platforms to introduce for those folks who haven't quite figured out yet for existing groups how to continue to meet. We'll make sure that we can do that. We're also looking at additional opportunities to experiment with the new environment that's so welcoming of technology in even new ways. And so there may be things over the coming year that we'll introduce that would be additional experimentations in using technology to reach out to the community in new ways. We're looking at all of our other programs and considering ways to adjust. We know that the Comstock grant program, the demand for travel grants has certainly changed as travel is no longer an option. So that gives us the flexibility and the potential to look at those services and see how we can adjust and keep them coming into the community. So I would say that we keep the commitment. We're looking at existing ways that we can adapt the things that we're doing already and also looking for ways that we can innovate. And I would very much welcome people who have ideas and suggestions to send them to us to consider and put them in the mix. So thanks.
Thanks, Sharon. That's great. David, we have a question for you in terms of someone wants to understand how the AFTD board sets the organization's priorities every year.
Yes, excellent question. As Susan mentioned, we've got a strategic plan that was created in 2019. It's a 3-year strategic plan, which will take us through 2022. So that establishes overall strategies and goals and specific things which we're trying to do over the long term. Of course, then the staff works very hard to, on an annual basis, to organize our work efforts around bringing about all those things that have been identified in the strategic plan. They do so with through the preparation of an overall annual work plan and a budget, which is then presented to the board, which the board reviews and then supports going forward. So generally speaking, that's the framework within which we take on a whole series of strategies and priorities. Now, we also, of course, receive feedback all the time from our volunteers and from families that are struggling with the illness, from persons diagnosed, through all members of our community, and those initiatives are brought into the overall work plan as a part of our ongoing efforts all the time.
Great, thank you, David. Nadine, we're getting a question for you about how science is being impacted by COVID-19 right now. The person wants to know how the current crisis and the need for social distancing, how that is impacting FTD research.
Okay, really good question. We've been talking to our basic scientists, and they're all working from home like everybody else. They're also doing Zoom calls like everyone else. They're doing their data analysis on their computers, they're writing up manuscripts, and they're all itching to get back into the lab. So I think they can hardly wait, but it's, you know, they're doing everything they can do remotely. Talking with our clinical researchers, especially the All FTD network, they have told us that they're still diagnosing new patients, and what they've finally implemented is remote teleneurology, and they've been talking about it forever, but they actually discovered when you have to do it, you can actually figure out how to do it quickly. And now they're very excited that this has worked so well that they might actually be able to bring this to their research studies routinely into clinical trials. So they're adapting.
Great, and Nadine, I'm gonna stick with you for one more here.
Okay.
Someone wants to hear a little bit more about our new partnership with Target ALS. They want to know why it took so long to partner with ALS research, and kind of what's been accomplished so far with the partnership, or what you might see as the potential.
Yeah, it's not that we haven't looked at partnering with ALS, and we've done it in different smaller ways, but this is the first big research grant program that we've done officially with an organization. We've co-funded some smaller grants before. So this gives us a chance to really dive into the FTD ALS spectrum, as it's called, and, you know, C9 gene mutations, but also people that can get both, and we don't know if there's a gene mutation involved. So what we're expecting to come out of this is new learnings about the underpinnings of that, the biology of what's going on in the cells, and hopefully be able to identify some new targets for drug development, but also learn if there's some biomarkers that would help us distinguish where you are on that spectrum, and hopefully understand how we can recognize those symptoms earlier, and maybe understand, you know, how does one gene mutation give you both of these very different clinically presenting diseases. So we're excited about that program.
Great, thank you very, very much. Ben, somebody wants to hear more. I know I mentioned Charity Miles a while ago. Somebody wants to hear more about that, and how people can stay engaged even during social distancing.
Great, thanks, Susan, and thank you for that great question. It's nice to be able to talk to so many of you during this time of social isolation. I wanted to tell you about Charity Miles a little more. In response to your question, we started in April, and that was our first time partnering with them. All that you have to do to sign up is, if you've got a smartphone, just download the app and select AFTD as your charity of choice, and you're set. And then any walking, running, or biking that you'll do, as Susan shared, for the months of April and May, it will be matched a mile per dollar, so that $1 will be donated toward AFTD's support programs for families for every mile you move. During April, that meant about $11,000 donated to support families through AFTD. And our goal for May is to go around the world in 31 days by reaching 25,000 miles together during this month alone. AFTD is hard at work creating a few other campaigns for you that you can engage directly in our mission. And we can't wait to tell you more about our Food for Thought and World FTD Awareness Week plans for this year. They'll look a little different, but we're hopeful that we'll be able to have a great impact. And in the meantime, we would encourage you to share your own family's story, as David did here today. If you reach out to AFTD's helpline and let us know you'd like to, our staff can work with you to find the best way that your story can bring support, hope, and awareness to others. Thanks.
Great, thanks, Ben. Sticking with family stories, David, we have a question from somebody. You mentioned that you had 3 kids, that Jenna and her husband also had 3 kids, and they're interested in knowing what you found most helpful in helping your children through the time with the disease.
That's a fantastic question. I think that everybody's journey with FTD is unique and different and challenging in its own specific and individual ways. In my family, certainly having kids at home made certain things much more difficult. And I think that very simply connecting with other families that are going through this experience, families with kids, it was profoundly helpful. And I know that we have an AFTD support group for families in which a diagnosed parent has children at home. I found that probably the most helpful, just insofar as allowing one to feel less alone. This illness and this journey can be so incredibly isolating and can make one feel so sort of alone in their challenges. And I think finding other people that have gone through this, or are going through this experience at the same time, or those who have gone through it, is profoundly helpful. I mentioned before how fortunate I was to have connected with a former board member of ours right after my wife was diagnosed, and her family had gone through a similar journey in which she had kids at home in high school when her husband had been diagnosed. And it's I can't overstate, I think, how much that contact and sharing those kinds of experiences with someone who's gone or is going through it can help.
Sharon, I know several years ago you led a task force that really tried to dig in on the special challenges of families like David's with kids at home. I'm wondering if you want to embellish on that at all, or some of the specific resources we've created in response to what your task force found.
Sure, yeah, and thank you. So the idea of finding the best match of support for what you need is one of the things that we really try to advance. And so for people who have kids, as David says, finding other people who have kids is a really key part of that. We've also learned, though, through the process of doing that task force, it was a great project because the support group that David's mentioning was a really integral part of our learning and our research and our understanding from those first experiences. And a couple of things that came out of it that were really helpful, you know, when you're the main caregiver and you have children at home, people look to you to be able to do everything. You have to wear all the hats. And the need to wear all the hats is really exhausting and it's not realistic. And so for each individual person to be able to have the freedom to look around and say, all right, where is the support that I can tap for what needs do I have? If you have kids who have to run to activities, helping them to stay in the activities is really crucial. Sports, back when we had sports, before the pandemic, they'll come back though. So pre-COVID, being able to know that if you have somebody who can help your kids get to those sports, that's going to be a really integral piece. It might seem easy, but setting up that kind of predictable patchwork can be really helpful for what are the needs that you have that are going to allow you to share the burden some because of all the hats you have to wear. And I think one of the really valuable pieces of information that we learned is that part of that is if each child has an adult, a responsible adult, a person in the family, in the extended family, an identified parent or parent figure who can give a little bit of extra time for that child, that can really make a world of difference. So that in some cases, we know people have been involved in a faith community and there's another family, godparents in the faith community that have known this family for a long time. And they were able to ask both the children at a certain age and that other family to say, you know, hey, I know that when it comes time for the prom, my wife is not going to be able to dress, to go looking for a dress with my daughter. Would you do that? to be able to kind of set up those special relationships that are not in any way taking the place of the parent who's ill or the caregiver, but where there's a way of just knowing and having the confidence that somebody is going to have a particular, have that one child particularly in mind. And then if you have multiple children in the family, it might be a way that others can also be helpful, just to know that on certain occasions you might need to be able to say to somebody, hey, you know, can you have my child in mind, and have a special opportunity for them to get together, hopefully to be able to talk and feel confident in getting that extra attention that they may need.
Great. Thank you, Sharon. Nadine, you're up again.
Okay.
Somebody wants to know what steps are being taken to advance early and accurate diagnosis of FTD.
Oh, that could be a really, really long answer. Just from the grant side, the Diagnostics Accelerator is doing that, but I think AFTD really led the way when we started our FTD biomarkers initiative, because there weren't really any organized programs to look for that in FTD. And biomarkers are a way of getting some kind of tool, you know, whether it's a blood test, like when you get your insulin levels measured for diabetes, something that will tell you objectively, yes, you've got this disease or you're at this stage of it. So our biomarkers program really led the way. And then I think we started to get more investments. So the Diagnostics Accelerator program built on that, and it expanded to not just FTD, but Alzheimer's and the other related dementias. So I think there's more and more drive now, especially on the government side, like NIH, to let's look at diseases like Alzheimer's disease, like FTD, like Lewy body disease, and better understand the biology of them, because that's how we'll find those biomarkers that can be an objective measure and indicators of early changes in someone. Because going by clinical symptoms, you all know that you've been through multiple diagnoses, a lot of confusion, several doctors, and it's because somebody can have a different symptom on a different day or a different month. So if you've got a blood test, a scan, you know, an eye exam, if that can tell you, yes, you've got early indications you've got this disease, that could save everybody, you know, a lot of anxiety and a lot of time, and make you more open to receive treatments in a timely way.
Yeah. And Nadine, I wonder, I think people may not realize FTD is a rare disease. In many ways, we don't know as much about it as we do about Alzheimer's, for instance, or Parkinson's disease. But I think in the quest for biomarkers, we're really, most neurodegenerative diseases are in the same boat, and it's advancing together. Would you agree with that?
Yeah, I think it is. And I think there's a lot of links between biomarker studies for FTD. Like one of the ones that we've supported in the Diagnostics Accelerator is looking at a protein called neurofilament that appears in the blood, and it reflects nerve cells dying in the brain. So we have supported a project that will take those blood measurements every quarter for 3 years in over 300 patients. And that's going to give us a really good high resolution view of how that marker is changing, because we already know broadly from research done in the All FTD network that neurofilament light increases in levels in the blood of people who have a gene mutation for FTD about a year before they're going to become symptomatic from their asymptomatic state. So that's a huge advance. But we also know neurofilament plays a role in all these other neurodegenerative diseases. So any advances we make is going to help Alzheimer's, will help Lewy body, will help Parkinson's disease.
Yeah, it's an exciting time.
Yeah, very much so. And technology has really caught up, so we can do this now. We couldn't really do this 5 years ago.
Yeah, one of the, just to stay on this point for a minute, I think one of the most exciting things is the BRAIN initiative, which was founded at the national level, I think less than 10 years ago. We're already seeing the technologies that have been produced by that major initiative as actually being put to work and advancing some of the specific knowledge that you're talking about.
Yeah, absolutely. And we're so much better at detecting very, very small amounts of these chemicals in the blood or in the cerebrospinal fluid. we've got so much better at neuroimaging technology, but also just as important is the analysis of all that imaging data to really understand what you're looking at, because the human eye can only pick up so many things. So being able to do a really high-level digital analysis has become a feature of so many of the tests that we do now and so much of the research.
Yeah, it's promising. A couple of our participants are asking the other side of that same question. We all know we need the technology and the biomarkers in order to be able to diagnose these diseases early. But the other piece of that equation is educating the medical community and ensuring that the physician who somebody goes to see for an evaluation even knows that this is a possible diagnosis for the symptoms that they are observing. I see that as a combination of awareness and educating the medical community. So I'm going to let either Sharon or Ben jump in, whoever wants to go first on that. Sharon, I'm going to put you on the spot first.
Okay, I was going to defer to Ben, but you can jump in, Ben, as we go along. It's critically important, and we know that, again, the experiences that we hear are how many times people go to physicians who just aren't familiar with FTD. So we do try to attack this from a number of different angles. We have one principal primary initiative that is really designed to reach out to professionals in the community that we are, with Ben's team's help on the communication side, we're adjusting and maximizing the impact of, and that's Partners in FTD Care. And this is an initiative that we've been running for 8 years or so that puts together quarterly newsletters that will take on one aspect of either the diagnostic sort of a clinical syndrome of FTD or particular issues within FTD, and puts together a case study as well as side articles that will really elaborate on that one issue. And then we distribute it electronically to our community. And in the past year, in order to really maximize the benefit of this information, our communications team has done a really wonderful job being able to take each issue and break it down into its component parts and use them and push them out even further through social media and drive more attention to the work that's being generated. The Partners in FTD Care initiative is actually driven by a group of volunteers. These are professionals who have truly decades of experience in the world of FTD and other dementias, who are sharing that with us on a regular basis to help develop the issues. We also have care partners who are part of that committee as well. So we try to provide a really well-rounded perspective with clinical information, but also with really practical tips. And so that's the main initiative that we're driving out there. But we also have volunteers involved. Our ambassadors are involved in doing outreach within their community to different types of professionals across the aging spectrum, as well as to hospitals. It's kind of geographically based. And these are leaders that have been developing within our volunteer program who have a particular interest in representing us locally in their communities so that we can be present in more places. And one of the main things that they are doing is doing some outreach to different organizations where professionals are working. So we know that in order to drive better diagnosis, we actually have to reach people at all levels of that professional spectrum. So physicians are critical, but people need to know throughout the aging network or in facilities when to refer. And so we're trying to take an approach that hits a lot of those touch points between the initiatives that we're driving here from the office and from the work of the volunteers in order to be able to get information about FTD in front of as many people as possible who could be even just recognizing what the red flags are, that it might not be what they're thinking. It might not be a psychiatric disorder. It might not be Alzheimer's disease, that they should consider something else. And so our strategy is really to try to have information that's being delivered in all different sectors across the community so that we can get those referrals happening to the right people so that people can get answers quicker.
And I would just complement that by saying that a huge part of AFTD's work since we were founded has been in raising awareness and in trying to get FTD into the popular imagination so that there's a lay understanding of it that can also inform families and then can go on in turn to inform medical professionals as well. And I like to think that that in recent years we've started to see what that looks like when FTD is more commonly known as a reference point. We've got TV shows like Zoe's Extraordinary Playlist about the PSP form of FTD now. A recent movie starring Javier Bardem regarding FTD, and so there are these. I think that combined with things like 60 Minutes providing coverage to millions of viewers over 2019, these are examples of FTD beginning to be understood more at a household level, so that when loved ones are experiencing changes, there's a chance that they may know before years have elapsed that FTD is a possibility, and they can bring questions to their professionals. And I think where I would leave it is with you in this audience, each of you, anyone with an FTD story to tell, you are an agent of change to raise awareness of FTD. The most powerful awareness tool that there is are you sharing your stories, whether it's on a platform like 60 Minutes or simply sharing your story with every health professional who will listen, making sure they understand your FTD journey, and within this current environment, how your FTD journey has been impacted in different ways for so many of you by this pandemic.
Yeah, thank you. Thank you, Ben and Sharon. The next question, how does AFTD navigate and stand out among a diverse and often crowded nonprofit world that is vying for relevance and for support from people and communities? I'd say that whoever asked this question must be in my head every night. These are the kind of things that keep me up at night. I think the short answer is everything we do here, we are laser focused on that mission. That is a lens that the board and I and this senior team brings to every single opportunity that's presented to us. One of our board members who's since rolled off the board coined the phrase all FTD all the time. I think this is the benefit of a smaller organization that can be focused on this one specific form of dementia. And I guess the other thing I'd say is I see our primary role is creating a community, creating a 360 community around this disease. So we work with people who have the diagnosis. We work with their direct family members. We work with the healthcare professionals, the caregivers. We work with the nurses and the physicians and the specialists who they encounter. And as Nadine has alluded to, we work very closely with the clinical researchers and the basic scientists. We're only going to fully understand this disease, be able to diagnose it and treat it, if we can get all of these different groups of people working together, pulling in one direction. And I do think that at the heart of our mission is the goal of building a community with all these people pulling together. I guess I would just add finally that I think everybody here, we're painfully aware that there is a lot of urgent need out there. There are a lot of important causes, especially today. And I think it's up to us to prove that an organization like ours can pivot, like you heard, hopefully you understood us say on this webinar, you know, some of the ways we've had to change how we deliver our resources, the information, how our wonderful volunteer support leaders can still stay in touch with the people in their community who need that support so much all of a sudden when you can't meet face to face again. It is on us to stay relevant, to stay nimble, and to keep listening to all of you, what you need the most and how we can help on this journey now, even as we work toward a future where there are much better options like medications that are proven to be helpful. Nadine, it strikes me they might enjoy hearing a little bit about our new form of pilot grant that supports research into well-being with FTD, and maybe Dr. Massimo's project just a little bit, if you would.
Okay, yeah, sure. After several flings at names for this new pilot grant, we finally settled on well-being and FTD. And what we really wanted, and our medical advisory council was really thrilled about this, is that we would fund research into looking at strategies that help people cope with the day-to-day. Like, what could we do for caregivers? What could we do for persons with the disease? And these would be non-drug approaches, non-treatment approaches, but just how do you improve daily quality of life? How do you get from this month to that month? How do you care for someone? How do you enable the person with the disease to live as full a life as they can? So we started this program. This is year 3, I think. And the very first one that we funded was a researcher named Lauren Massimo. She's at the University of Pennsylvania. And she created an app that was going to be able to help you determine the level of like apathy, empathy. And it's a tricky thing to do because these are critical clinical diagnoses, but using an app and making it in more of a game form so that the person with the disease could actually input was a game changer and something very different. So it's been, in the early development stage, we started funding that, and now it's, with an IT team that's at UPenn and trying to make this into a more user-friendly app that could eventually come out on a smartphone or elsewhere. And that's really been the beginning of a trend of other diseases doing similar things and trying to get that in-person feedback. And you can do this with caregiver reporting, you can do it with the person diagnosed reporting. So I'm really pleased that we've been able to roll out that other initiation of our pilot grants, because we started pilot grants back in 2005, and I think we were really the pioneers in focusing funding on FTD. There wasn't much being done, and I think we've led the way, and I think we've funded a lot of new investigators who have helped spread the word. And the things that they do now just amaze me of how complex and how much they've led to the understanding of the disease, and how this has now led to some really groundbreaking therapy opportunities that will be coming in clinical trials in the next few years. So it's been a really quick journey.
Yeah.
Susan, can I just add to in terms of the relevance of what Nadine's describing with the grant to Dr. Massimo, there's a lot of technology applications in the dementia world that are out there that people see all the time, and most of them are memory-based. And while memory may be a part of many dementias and can be a part of FTD, the ability for us to have resources that can be devoted specifically to looking at this explosion in technology and tailor it for the kind of behavioral symptoms and really the core symptoms that our community faces. And apathy is one of those things that's just really distinct to FTD and really challenging to address. So the idea that we have this opportunity to have helped bring together the sort of explosion at looking at wearable devices and apply it to the challenges that we know people with FTD are facing, I think is really a great example of that relevance that the questioner was asking about.
Yeah. And I might just do a fast plug for Emily Rogalski, because this was the first type of grant that we funded, but it came under our basic pilot grant kind of grouping. And she created an online speech therapy tool. And nobody had ever done that before, and particularly for primary progressive aphasia, an FTD subtype. They had it for all other types of speech language things, if you had a stroke and you're learning to speak again, but this is really groundbreaking. So this is now, I think, in its 3rd clinical trial phase. You can get it online, easy to access, and it's been incredibly successful. And what I really like about this one is, one, we were the first people to really fund and invest in that idea, but also that, again, it was speaking to directly the person with the disease and their needs and trying to help them where they are. So I really like that program too.
Great. I'm sorry, I'm too interested reading the questions, and we're running out of time. There's one person here who says they're aware of other small grassroots organizations, perhaps being founded and local to different areas, dedicated to either care or research for FTD. And how does AFTD work with these other groups? The answer is we are very open to working with groups that are founded across the country and around the world. We work very closely with groups like the Bluefield Project, the Tau Consortium that's funded by the Rainwater Foundation. We have a wonderful family foundation in Connecticut that we work with round the year. So We are very open to sharing our experience and helping others grow up their own charity focused on their specific angle of the disease. But I think one of the most things I've been most excited about is our ability to nurture aspiring groups around the world. And Ben, I know this is an effort that you've led for us. It's been coined World FTD United. And we all know that to be successful, we're going to have to run international clinical trials. And there's a lot of advocacy work where we can all support each other, even across borders. So I'm wondering if you just share a little bit about your work with our international peers.
Sure. So I would say that part of Helen Ann Comstock's vision that she extended after founding this organization was over the years in helping to nurture organizations in Spain, in the Netherlands, and in other countries, just to start, and in France as well, to start to build up sort of national level FTD focused organizations in those countries. And how that has borne fruit is that we now have a group called, as Susan mentioned, World FTD United, where different leads and different participants in those different organizations, where we work together to try to come up with ways to raise awareness and to share care strategies on a global level, to share things that from Australia that may inform efforts here or in other countries, things of that nature. So what's great about that is as other countries learn different ways to help address dementia and FTD, that can in turn create a feedback loop so that while bringing AFTD's experience, we can also bring some knowledge from those countries to benefit folks here and in local communities.
Great, thank you, Ben. I'm afraid we're going to have to end this. I want to thank everybody. We've had a lot of people with us throughout the webinar, and these are excellent questions. I'm sorry we can't get to all of them, but we're thrilled that you could be here today. I want to thank David and Ben and Sharon and Nadine for your time and your expertise on this. And of course, we want to thank our sponsors who made this webinar possible. And as I said, especially David, for sharing your family story and for turning your energy and your commitment to partnering with AFTD, because we need energy like yours, and sadly the earned wisdom that you have. We hope all of you found this presentation to be informative today, and you leave here with new tools that you can use during these challenging times. We will post this recorded webinar on AFTD's website under News and Events, and send out the link to you as soon as it's available, which will be within the next few days. Please let us know if you have any comments or questions about today's presentation, or if you have ideas of other ways that AFTD can assist you moving forward. This is the final installment of AFTD's Education Conference webinar series. We hope that you've found these useful. If you missed any of them and would like to watch them, please do visit our website. All 5 are posted there. We'll be working with experts in our field to create additional educational webinars to help you and your families cope with the difficulties this journey presents. Thank you for joining us today, and we wish you the very best in the warmer months ahead.